In the last 24 hours, we have 4,100 people, young people who have signed up, all below the age of 35. We just for opportunities. Yes, so for jobs, for funding, for skilling, and we will continue to grow the platform and make it useful to all young people.
No promoters, these are your officers.
Welcome, Your Excellency. What we are doing with the community health promoters, we are supporting all the 47 counties to accelerate universal health coverage through digitally empowered, compensated, and kitted community health promoters. So you can see the numbers there, where we have 108,000 CHPs enrolled, and they have been able to register 8.78 million households, and they are currently visiting more than 7.6 million households. And we have done a lot of screening for diabetes, for hypertension, and referred many people who didn't have known that they have these conditions right in their home. So we are actually bringing health to people's homes.
You people are the best.
Thank you so much. Thank you so much, Your Excellency.
I am all in.
All right, Asante.
Very good. You guys are the best.
Yes.
Thank you. DHA is my place.
Thank you.
Okay. Yes, Mr. Anthony.
Thank you, Excellency. Welcome to our booth. We just want to show you our mandate is really very short. We just want to digitize each and every part of healthcare.
Digitize everywhere.
Every part of healthcare, Your Excellency. We had a plan, and we want to show you how far we are. Just in short, we start with SHA. This is my team, and Dr. Amisha will take you through SHA, and then we'll go to Digital Health Agency of the facility and the rest, and my colleague there will take you through. Joyce, please.
Thank you, sir. Your Excellency, at the Digital Health Agency.
It's okay.
At the Digital Health Agency, we believe in data, real-time data for use. So the first stop was the SHA registration dashboard. And as for today, you can see we have already registered 6,152 people. As of now, of course, by evening, we'll have reached about 30,000, 34,000. And then approximately half of the Kenyan population is already registered for SHA. And then, Your Excellency, registrations typically are happening at the health facilities. We need to change the Kenyans' mentality about seeking for health care, because you should be registering for insurance when you're happy and healthy. Exactly. Exactly, but you can see from how we are doing things, our registrations are lowest over the weekends, yet they should be the highest because we have self-registration and even assisted registration with the CHPs. Young people are the majority that are registering, on average about 32 years. Males and females, 1-to-1 ratio, so wanawake they are not being hidden behind. So it's important to check that. Then on children, we have our dependents. They're about 8.9 million. We expect a bit more. Yeah, exactly. Yes. Exactly. Yes, yes, sir. Yeah. Yes. Yes. Exactly. Exactly. And then under means testing, which is done by the people who are basically not employed, the one for normal check-off. So we have about 6.2 million who have done their means test. Yes. And then we have a county registration where we are monitoring the counties, that's how things are happening at the counties. Mombasa is highest at 67.5%. Homa Bay, where we are, is at about 13%. Sorry. Oh, actually 47. and number 13. Yes. And then we have a dedicated county dashboard for the governors to have a look and see some more information about their counties. Exactly. Exactly. Yes. Yes. Your Excellency. Yes. Then exactly. Then something else that is interesting, Your Excellency, we recently have started one bed, one person. And we are monitoring the bed occupancy. In our, currently we have about 137,000 beds, normal beds, and our occupancy is at about 50%, so 49.93. And we can be able to see ICU beds and even HDU beds. Your Excellency, if COVID happened today, we would be able to monitor things that we were using an Excel sheet then to monitor now digitized. So this is, we are on a great journey, and we really, really appreciate your support. Thank you. Sorry.
Tell me about the identification. We're still using IDs.
Yes.
In our facilities in 2, 3.
Yes.
Some 4. So what is the plan?
So, Your Excellency, we went live for the biometric identification for all our level 4 and level 5 and 6 facilities, which are now using biometrics to do. 1,094. And we are just now ensuring that, because we still have some small challenges of small failures, we are now tightening that system. Then the second is we are rolling out in every level 3 and level 2. So that we expect that in the next 1 month or so, we shouldn't have anybody using OTP, unless you have a condition whereby you are not able to. Yes, we have a fingerprint of the problem, and we have created a process that must be approved for you to be properly identified. But Your Excellency, I will take you through the highway now. You remember we had the five key pillars. Before I give my colleagues, one was enabling environment. You gave us a law. So this is now also anchored in the law, so that we ensure that everybody uses the digital system in providing of services. The next was the ICT infrastructure, and in terms of ICT infrastructure, we are assisting every public hospital, every public health worker. We are giving them a device. So far, we have distributed 15,000. We are supposed to do 74,000. We have the devices in place, Your Excellency, but we don't want to give devices without training. So it's moving with the speed of training. And that is how we are implementing that. Our health information exchange, I'll give my colleagues to take you through. This is also live. We have been able now to actualize this from being a plan to a reality.
Thank you, Your Excellency. My name is Dr. Jeremiah Mumo. This was actually a PowerPoint thing, but we have virtualized it from now. It's no longer a PowerPoint. And the reason is live, Your Excellence, is that at any given time, if it's patient portal, when you click, it will automatically open to you our Afya Yangu, and our clients will be able to move to that. Again, we have also actualized our point of care system as the Taifa care systems, which are used in all our facilities. And we expect with this to be able to, all the clients to see, even at governance levels, at any level, to see how many clients will be coming, because we have an interactive dashboard to see what is happening, registration. You can see the queues who have been waiting and triage, who are waiting at consultation at the comfort of the office. You can also see the number of patients who have been admitted. And again, you can as well see the procedures which have been undertaken in the hospitals. This goes up to the reports, and again to specific diagnostic areas, Your Excellence. Again, we have also managed to able to share information. What we have been talking about, if you are in Mombasa and you come to Kisumu, you can get your records. Initially was a story. We have virtualized, Your Excellence, through what we call the shared health records. So with this, you'll be able to navigate yes, Your Excellence. Yes, Your Excellence.
Once you take your X-ray, maybe you took yesterday, you move to the next hospital, your data is there, they should treat you, and they shouldn't charge.
Yes. And we can monitor this, Your Excellence, real time. Like now, this is what is happening across the country. For the last 1 hour, you'll be able to tell what is happening in terms of, for the last 1 hour 10, we had already 20,000 people being seen either through observation, diagnostic, or prescription of drugs across the country. And this information can be relayed from one facility to another across the country. Your Excellence, also, we are also able to monitor our doctors and our healthcare workers through the health worker registry, which was again a dream. And with this, we are able to know the numbers, what is happening in terms of doctors, and want to make it reality so that even Kenyans can know how many doctors we have, how many nurses we have in the country, and all different cadres we have in the country. So now this is a reality. And again, we have an application which we call the Know Your Practitioner. And again, we have now what we call Practice 360 to enable the doctors to do prioritization within a radius of 1 kilometer.
We localize.
Yes, Your Excellence. Yes, Your Excellence.
You have already geofence and geotag every facility. You can't approve outside 1 kilometer, which is within that radius of your facility. And we keep making it tight because we realize that some health workers are in very far distance outside 1 kilometer, which is within that radius of your facility. And we keep making it tight because we realize that some health workers are in very far distances and
Deliver health in a very, comprehensive way and effective, because we will know what the gaps are and all the other things. I think we can assist America. I saw.
Probably even we're doing the same right now. But data protection is a big problem.
So I saw President Trump struggling. I think we can send some experts. And Ambassador here says also to jump.
Thank you so much.
Thank you guys. You guys are doing a great
See real time, what's happening in the county.
Okay. So are you working with some counties already?
This is Homa Bay, actually. They are the ones who've really worked with us in tightening the system. That's why our revenues 700, 800%.
Very good.
And now we have incorporated artificial intelligence into the system.
Yes.
So now the system can actually detect where the problems are, leakages maybe, can predict what the future revenue is going to be, what we can do to improve the... Yes, sir.
Yeah.
Actually, we can talk to it.
How much have we collected today?
Right now,
How much have you collected today?
We can even speak Swahili. Thank you.
This Water Resource Authority. We have, these are the equipment that we use now for water, groundwater monitoring. It's a very modern equipment. Nowadays we have minimized now what we call dry boreholes. For example, this one is called magnetic. It can go up to 600 meters.
Down?
Down, yes.
Okay, to know where there is water.
Yes, you can see now this gap here. This is the area where the water is.
Oh.
These are rocks.
Okay.
The blue is here.
So
In
you
fact,
know where to drill?
Yes.
Okay.
Yeah, we have minimized.
So we stop the guesswork?
Yes, we have also seismic method where we can send a signal to the ground. This one, yes. It can go up to 2,000, 3,000 kilometers.
You sort out that small problem with the tariff?
Yes, the regulation is ready. We are implementing, yeah. Yes.
Very good.
Yeah, thank you, sir. Sorry, sir.
Thank you.
Thank you.
Your Excellency, you have seen a lot of exhibitions on the other side with the community health workers telling you, SHA telling you. I think here is the story of what has this done. Telling you. I think here is the story of what has this done. Today we're celebrating but because of this integration from community to being able to deliver blood, to being able to do trainings, we have the MPDSR.
Thank you, Your Excellency. So, as Her Excellency the Governor said previously, we were losing so many mothers. What we have done differently is we know where every single mother who is pregnant is in Homa Bay right now through our CHPs. As you can see, they walk around with their gadgets. We are able to tell their blood pressure so we can know what problem they have. They are able to do blood glucose testing and so on and so forth. So, Your Excellency, distinctly, every Tuesday morning at 7 a.m., we have a national meeting chaired by ourselves, and Her Excellency the Governor personally attends, including DG Amoth, PS Oluga, and the others. And we discuss every single maternal mortality that we have or a near miss. And through that, Your Excellency, we have managed to achieve 96 days of zero maternal deaths in Homa Bay County. And significantly, Your Excellency, what used to kill mothers before in Homa Bay was obstetric hemorrhage, bleeding a lot before, during, or after birth. And as you can see, we have put measures in place, and right now, it is no longer the #1 killer of mothers in Homa Bay. Thank you.
Your Excellency, that's the effect of the interventions that we have made there, including working with Zipline to deliver blood and other essentials to the far places. Your Excellency, we have value chains here in Homa Bay, and we've been growing the value chains. Just move a bit, Adele. So if you look at sweet potatoes, we are the highest producers of sweet potatoes. We moved from about 169 tons to 173 tons, 78 tons. For cotton, we moved from planting 1,800 hectares, planting 5,200 hectares. And the most important thing there is the value, because you know the price has moved from 52 to 72. So the value has gone much higher. Sunflower, we moved from only 125 hectares to over 1,050 hectares. And the value, excellent.
Proposed Homa Bay City. This 3D model is transformed from the plan of the city. We want to transform Homa Bay Municipality. And so we have key flagship projects, one of which is to relocate the sewer system, which is currently at the lakefront. We want to relocate it to another location that we have provided in our proposed plan. Also, Your Excellency, this side we have informal settlements called Shauriako and Sofia. Through BETA, we want to transform it through social housing to accommodate the informal dwellers. Thank you, Your Excellency.
Thank you very much. That's a vision. That's Kabunde, and that's the new headquarters that we had this morning. Excellency. FAO are our great partners, Your Excellency.
Welcome, Excellency. This is FAO stand. Thanks when you met our DG last week in Ethiopia. So here we are working to support the government in 4 major areas. On the area of land, digital land governance, 3 areas, 20 million euros supported by the EU government. We are supporting the alternative justice system. Excellency, in Narok, in Kajiado, there is a lady whose 100 acres of land was not able to get out of court. Alternative justice system supported by FAO, they are now okay and they are using their land. We just launched a $40 million project on youth employment in ASAL areas. This was launched by CS Beatrice School in Turkana last week. So we're going to give a lot of employment to the youth.
Thank you very much. Hi, Miss. How are you?
Yes. So, you know, you brought me up in the farm. Every Easter, every Christmas, we used to go to Ushago. And this is the work that has come from it. We are working with traditional beekeepers so that we can move from here until here. We're also working with young people in agriculture, and we've planted 754,000 trees as young people so far to contribute to the 15 billion tree campaign. Thank you for your mentorship.
Ushaleta Kevin. Ushaleta na ushagrab kwa speeches. Unasema yako. Sawa, ushaleta.
Karibu sana Mheshimiwa Rais wa Jamhuri ya Kenya. Tumkaribishe kwa makofi. Welcome Your Excellency. Karibu sana Mheshimiwa Rais to Devolution Conference 2025 held in the Great Homa Bay County. Karibu sana Mheshimiwa Rais. We shall remain standing as we will start with the two anthems, starting with the Kenyan national anthem, followed by the East African anthem. The anthem. Tukiwa tungali tumesimama kwa heshima Mheshimiwa Rais, naomba nimwalike Ali Abdullahi Hachi na Reverend Kennedy Zangu watuongoze kwa maombi. Karibu.
Bismillahirrahmanirrahim. Naanza kwa jina la Mwenyezi Mungu mwingi wa rehema na mwenye kurehemu. Ya Rabbi, tunakushukuru kwa kutufanyia ufanisi wa hafla muhimu ya watu, muabudiwa wa watu. Tunakuomba kwa utukufu lako lote, ya Allah, kwa sifa zako njema, ubariki taifa letu. Ya Rabbi, utulinde wakati wote, utupe amani. Ya Rabbi, utupe salama, utupe mashikamano, umoja. Ya Rabbi, ulinde taifa letu, udumishe amani na maendeleo. Ya Allah, ufanye nchi amani ambayo inayependeza ulimwengu. Ya Allah, ya Rabbi, tunakuomba umjalie kiongozi wetu Mheshimiwa Dr. William Samuel Ruto, umpe hikma, ujuzi na ujasiri wakati hali ngumu na wakati hali iko sawa. Ya Rabbi, tunakuomba uwajalie viongozi wetu hikma na uthabiti ili waudumikie taifa letu. Tunakushukuru kwa kutupa gavana chupafu. Ya Rabbi, ulinde gavana wetu na wasaidizi wake. Ya Rabbi, tunakuomba uko na ubungufu ya kibinadamu, utasamehe makosa yetu. Ubariki taifa letu, ubariki viongozi wetu, utusamehe dhambi yetu. Allahumma salli ala Sayyidina Muhammad wa ala alihi wa ashabihi wa sallam. Amina ya Rabbi wetu. utusamehe dhambi yetu. Allahumma salli ala Sayyidina Muhammad wa ala alihi wa ashabihi wa sallam. Amin.